Hi learners, it's Em from Sound Nerds, and in this video we're going to take a look at parathyroid pathology. So what's in it for me? Well, sometimes we do see some kind of odd structures outside of the thyroid. So if we know what parathyroid pathology looks like, we can help in determining the source of these abnormalities. While we're going through these though, I also want you to focus on the lab values, because if we see certain lab values in patients that indicate parathyroid pathology, then we also want to make sure that we are aware of what we're looking for. So we're going to start with something called primary hyperparathyroidism. And this is an endocrine disorder that causes the parathyroid glands to over-secrete PTH, or parathyroid hormone. Now this is going to be something that's going to be diagnosed by labs. So a blood draw will be done, and they'll see that there is an increase in PTH. But along with that, because of how PTH works, we're also going to see hypercalcemia, which is excessive calcium in the blood. We're going to see hypercalciuria, which is excessive calcium in the urine, and hypophosphatemia, which is low phosphorus. Now, because of all this extra calcium in the blood and what needs to be filtered out by the kidneys, we see that kidney stones commonly go with primary hyperparathyroidism. And then because that calcium has to come from somewhere, it's usually from the bones, so the patients typically also have osteoporosis, making this a very common disease as well then for females over the age of 40. So primary hyperparathyroidism is an endocrine disorder that causes the parathyroid glands to over-secrete that PTH, and because of that extra PTH, we see issues arising in other organ systems. So that brings us to the parathyroid adenoma, which is a solid benign mass of the parathyroid, but happens to be the most common cause of primary hyperparathyroidism. And that is because the adenoma can start to function on its own, releasing that PTH without any input from the rest of the endocrine system. Remember that when we look at the parathyroid glands with ultrasound, we typically don't see them that well because they're a little too small for our machines. However, once an adenoma appears on a parathyroid gland, those adenomas and parathyroids become much more obvious. So on ultrasound, we'll see a large hypoechoic mass that is just outside of the thyroid, either on the inferior pole or on the superior pole. They tend to take on a little bit more of an oval appearance, a little bit more hypoechoic, but still very homogeneous. So if that parathyroid adenoma is producing too much PTH, then the patient is going to have all those symptoms of primary hyperparathyroidism. So again, we see the kidney stones, the osteoporosis, all of the labs with the increased PTH, hypercalcemia, hypercalciuria, and hypophosphatemia. As that adenoma increases in size, it might become a palpable neck lump. So on the bottom here, we can see lots of examples of parathyroid adenomas. Again, they are hypoechoic structures that usually sit posterior to the thyroid gland itself and tend to hang out a little bit more towards the inferior pole or towards the superior pole. Here's an example of a parathyroid gland towards the inferior portion of the thyroid gland that's here. And here we have one in transverse. We can see the adenoma sitting a little bit more on the medial portion towards the inferior side of the thyroid. Now, the second most common cause of primary hyperparathyroidism is parathyroid hyperplasia, and that's where you can have benign enlargement of the parathyroid gland. So this would be very similar to goiter in the thyroid, where just the whole gland gets kind of bigger. That's parathyroid hyperplasia, just the whole parathyroid gland enlarges. And with parathyroid gland hyperplasia, we can see that all of the parathyroid glands might be affected, or maybe just one. So in this example here, we can see that we have 3 relatively good-sized parathyroids and then 1 smaller parathyroid. But the same principle is still in effect. Those enlarged parathyroid glands are most likely producing extra PTH, causing that primary hyperparathyroidism. Now there is a secondary hyperparathyroidism that exists as well, And this is going to be a disease outside of the parathyroid that causes increased PTH production. So remember that primary hyperparathyroidism is a disease of the gland itself, and we saw that with adenomas or parathyroid hyperplasia. Secondary hyperparathyroidism is going to be something that's outside of the parathyroid system, usually some sort of deficiency like low calcium or low vitamin D that causes that PTH production to increase. So now we've added a few things into our clinical signs and symptoms, etiology, and labs and other tests. Again, this is going to be a disease that's outside of the endocrine parathyroid system, causing the parathyroids to overact. The big one is going to be hypocalcemia or low vitamin D. PTH is activated when there's low calcium in the blood. So PTH is released to increase the calcium that's in the blood, to allow the bones to release calcium, to stop the kidneys from filtering out the calcium, and for the intestines to absorb more calcium via the vitamin D that's released by the kidneys. So when there's hypocalcemia or low vitamin D, the parathyroids get the message that we need PTH to increase both of those. But if there's something else going on and the body's release of PTH doesn't actually improve the hypocalcemia or the low vitamin D, then that PTH just keeps getting released and released and released without the desired effect. And so we still see kidney stones, osteoporosis as issues, but now we have even more issues with bone and joint pain, increased urination, and we see this often in patients that have renal disease. That's going to be an issue for the hypocalcemia and the low vitamin D. Rickets, same idea for the vitamin D. And then malabsorption, again, causing issues with how much calcium and vitamin D can get from the diet. So secondary hyperparathyroidism is most likely going to be diagnosed by those labs and other tests as well, but if we do get an ultrasound for it, we are going to see some enlarged parathyroid glands. And then lastly, we have parathyroid carcinoma. This is a super rare cancer resulting from an adenoma malignant transformation. So an adenoma on the parathyroid can transform into a malignancy. Again, very rare. When this occurs, ultrasound is going to show a very irregular, enlarged parathyroid gland. So that means that there's going to be this irregular mass off the parathyroid. The adenomas typically are nice and smooth, where adenoma malignant transformation is going to appear more lobulated, more irregular borders. We're going to see increased vascularity along with that, the taller than wide appearance that cancers take on, and a heterogeneous appearance.